RML Mphil Syllabus 2025. In this video, we are going to do a detailed analysis of your complete syllabus of RML Mphil entrance examination, which is going to be conducted on 2nd of November. For that preparation, if you have still not joined in the RML program, then make sure you joined it before in the early bird offer so that you can prepare very well for the upcoming examination with all the details and insights. To join quickly, write us on the given email ID in the description and enroll yourself in the program. If not, let's enjoy the video. First of all, this syllabus consists of these all topics. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So 13 topics they have given overall to you to prepare for the examination on 2nd of November. And if you want to clear this time RML Mphil entrance, you have to be well enough in all these topics. Okay, apart from that, they have also mentioned that the distribution of marks shall broadly be as follows. Okay, so out of these they have also given the detailed thing that okay, these many questions they will be asking definitely for the upcoming examination. Okay, now first of all, they have included general psychology, which every Mphil entrance exam is made of, or they ask every question from your general psychology portion, like basic things like what is happening in Gestalt and what is the basic school of thought and all these things about structuralism, functionalism and all those basic things, and okay, who has given what, who has given what not, those like that. And now after that, there is child psychology, which is a very important component of your Mphil entrance preparation of particularly for the RML examination. Okay, why? Because this is the only premier or the only very first examination this is asking you about child psychology. Okay, that is 15%, so you can assume 10 to 15 questions from this child psychology portion. Okay, now for that, what you need to do is just read. It is not like you have to go and read child psychology book, not at all required. What you can do is from the GEF, from the germinal, embryonic and all these stages, from the very basic infant to adolescent, what all stages you are gone through, what are the major theories in that, maybe Erikson, maybe John Piaget, Sigmund Freud, and all those combined will be asked in the child psychology portion. Now next topic is your clinical psychology. Now for this clinical psychology, it is basically the disorders. And why not therapy we are including over here? Because they have already given this separate component for your counseling and psychotherapy. Okay, so for every therapy portion, for every therapy part, you have to be thorough what all those are there. But right now, if we talk about clinical psychology, then basically on schizophrenia, definitely there will be a question on schizophrenia, the positive and the negative symptoms, what happens, what not, and the generalized anxiety disorders, and about the phobias and a major depressive or depression disorder. Okay, these are the major components that will be asked in the upcoming RML examination. And in the RML program, we will be doing questions on these regularly on the regular basis. You will be having questions daily, unit wise on these topics, and the combined whole mock test as well. Okay, even the free mock test will be uploaded on the official Telegram group, so you can also join there for the free mock test as well. Now this research methodology and statistics, for this you will refer to the ebook and do questions from there. And this is also an important component. What will happen over here? They will ask you about the ANOVA, they will ask you about ANCOVA, they can ask you about MANOVA and the factorial design and factors and things like that in research methods, as well as they will ask you about sampling as well. Okay, which type of sampling and the difference between the probability sampling and the non-probability sampling as well. Okay, so these all topics will be covered in the research methodology and statistics portion. And now interestingly, there will be 5 questions approximately on the social psychology portion as well. Okay, so what they are going to ask, definitely there will be question on diffusion of responsibility or social loafing or social facilitation. Even if you are prepared with all these topics thoroughly, they can also ask in the applied basis or in the applied format, they can ask about that as well. And even if you prepare all these topics thoroughly, it will be enough. Okay, you don't need to read each and every single social psychology concept for these odd 5 marks. Okay, but you have to be very accurate with all these topics, and for that C book will suffice. If you have done social psychology from C book, done the CC series questions from the for the social psychology, that will be enough for the upcoming Mphil, because they have allocated only the 5%. Okay, Now next is important for you, psychological assessments and test. Okay, so major type of, as you can see, neuropsychological assessments, so maybe Bender Gestalt or Luria Nebraska will come into picture, and the different type of psychological assessment we will use called as the MMPI, factor analysis and whatnot. These all becomes important and all is covered from the A series as well. Okay, and different type of test, they will ask you about the concurrent validity, reliability, validity, norms and questions on these as well. Okay, so these will be the major portion, 15%. These are approximately 10 to 15 questions they are going to ask you in the upcoming 2nd of November. Okay, so you have to be thorough. At least, even if you want, you can leave all these topics, but we will not leave this in the RML program. Okay, all these topics will be covered from general psychology till this therapy and psychological assessment interventions. But if you want, you can leave some of these topics, but what they have given over here, you cannot leave these topics. Okay, general psychology, you cannot leave any single topic that is mentioned over here. And now talking about counseling and psychotherapy, majorly they will ask you about the therapy sessions only. Okay, Gestalt therapy and feminist therapy and various humanistic therapy, existential therapy and different types of therapy they can ask you from this particular portion of your counseling and psychotherapy. Okay, and for this, do you need to read any single book for psychotherapy? Yes, you want, if you want, you can read, but doing this thing from C book will only, it will be enough. Okay, more than enough, because at the end of the day they are going to ask you about unconditional positive regard and all those things only. Okay, about client-centered therapy and all those things, but still you have to prepare. And majorly to cover all these things, if you do CANF books properly, do the CANF 7000 properly, and if you are enrolled in the RML program, that will be enough. If not, you can also do the previous mock test we have conducted on the Telegram, and that will be enough for this. Major thing is that you have to revise well. Okay, revision is very well, because in the previous examination, people who have scored 90, 91, 92, why they lag, why they could not score above 95 or around 94, 95, 96, why like that? Because of lack of revision. Okay, even 1-2 silly mistakes will cost you a year. Okay, this is very important. Even losing 1-2 marks will cost you a whole year, and you have to give this particular examination again. You have to go through the chain, the loop again and again. That is why it is very important that you have to be very accurate with your entrance examination and also with your preparation. For which examination you are giving, make sure it is clear, made up in your mind, and you are doing preparation according to that, because every Mphil entrance has its own demands, different demands. Okay, if you don't know about demand characteristics, make sure that you do that, because it will come under this, and doing the CANF books properly will suffice for everything. You don't need to read any other single book. Yes, for the enhancement of knowledge, you can do all those things, but apart from these 4 books, once you are done with these 4 books, then and only then you need to switch to other books, maybe for biopsychology or maybe for another topics, but that is the later requirement, not the premier one. Okay, so doing these books is very IMP. Doing mocks from these things is very important, and this is the complete syllabus of your RML Mphil entrance for your session 2025 and 2026. Okay, as you can see over here, 2025, 2026, this session, this syllabus they have given, and this becomes very important for you once again. Okay, you cannot leave any single topic. Okay, if we talk about health psychology, you have to read about the immune system as well. Okay, what is happening in your immune system, what is the role of ACTH, what are the adrenal glands doing, what is the role of CRF. Even these small things they can ask you in the RML entrance, because this paper might be tricky for you. It is not going to be, never going to be that easy like the ABAS examination. Okay, so if you have given ABAS 2025 and if you are thinking it is going to be on the same pattern, then so sorry, this is not the case with the RML examination, and you will soon see shortly that why this is the particular case. Okay, now your CET code is 157. If you have still not filled the form, then there were a lot of comments about the center code and whatnot, then the CET code is your 157 over here. Your examination is Mphil clinical psychology, and total number of seats they have given is 13. Okay, they have not mentioned about the not unit wise, the reservation quota they have not mentioned, But what you need to aim is, you have to aim for the higher score. Try to score out of 100, 99, 98, 97. People are doing this. You can also do this right now. But one thing is for sure, you have to be accurate. You don't need to read different topics, different day. You need to stick to all the basics and the little advanced topic for the RML Mphil entrance. But majority of marks you will be scoring from the basics only. Okay. This is very important, and you need to prepare according to this syllabus. Okay, according to this syllabus you need to prepare, and if you do according to this syllabus, you will be able to qualify for the interview. They are going to conduct interview as well. Okay, so reservation shall be as per the central reservation policy. The admission to the MPhil programs shall be done on the all India basis. But that is not the point of this video. The point of this video is your MPhil clinical psychology syllabus for RML Mphil entrance. Okay, number of seats is 13. So make sure if you are watching this video, you are among that 13 who is going to clear this Mphil entrance and will be sitting for the RML entrance on 2nd of November. Clear the examination, give the interview, rock over there as well, and take your one seat out of these 13. Okay, but one thing is for sure, revise and be accurate. Don't try to do difficult topics. Do the simple basic topics so accurately that it becomes impossible for you to do negative marking. Although there is no negative marking in this examination, but it becomes impossible for you to mark the incorrect option over there. Okay, people are still confused between the latency stage, the phallic stage, and the oral anal what stage not. Okay, they are still confused that where is Oedipus complex happening. So if you are one of those, then definitely this examination will be very difficult for you. So make sure you are prepared, because people are so accurate. They are doing the right thing. And now it's your turn to do the right thing and study according to the syllabus. Okay, motivation and personality, no matter what, read about Abraham Maslow, read about this Gordon Allport, and all the basic stuff you need to do properly, so that even the difficult questions will seem easy to you. Thank you and have a nice day ahead. And those who are interested to join the RML program, check the description, write us on the mail, get details of what this entitles or what does it contain, RML program, and you will be one of those. Thank you.